Citizen Action, and I see Phyllis is here as well, and Audi, thank you so much for really kind of laying out, what we're trying to do, what the problems are, and, being so hopeful about the future, which I'm often not, I have to say. I'm always glad to see that someone is so hopeful. It's really, and of course my colleague, Bonnie Watson-Coleman, I know Senator Menendez is going to be with us a little later. So I wanted to say a little bit about, what we try to do with the Affordable Care Act, what the Republicans are trying to do to sabotage it, and then be as brief as possible because I know we've got a lot of speakers here. The reason why the Affordable Care Act was such good legislation, and I was involved in drafting it, is because we recognized several things. First of all, we recognized that fewer and fewer people had health insurance, particularly in the individual marketplace, or even people who were working but didn't get it on the job. And so we had to do something. And when it passed and it became law before Trump came into office, we were at about 95% of the people in the country had health insurance. Most of the people that didn't were the undocumented. So we did a pretty good job, in my opinion, and it was certainly affordable, or at least relatively affordable. And we accomplished it essentially by saying that for people on the individual market, we were going to do one of two things. One, we were going to expand Medicaid to a little higher income because a lot of the people were working but weren't getting health insurance on the job. And if we expanded Medicaid to a little higher income, we would take in about half of the people that were uninsured. And then the other thing was to provide a subsidy or tax credit, kind of the same thing because it was a tax credit that was applied to your premium, so it really was a subsidy, for people who were above the new Medicaid cutoff, if you will, but still didn't get health insurance on the job and weren't able to pay the full freight of their cost on the individual market. So that's how we got to essentially 95% coverage before Trump came in. But then the other issue was with all these discriminatory practices, and that's, I think, what Audi was talking about in part, is that we had so many people that, because of pre-existing conditions, because of cutoffs on an annual basis or cutoffs for your lifetime, that were just denied coverage. And so we said, all these discriminatory practices are gone. You can't deny coverage or charge a lot more because of pre-existing conditions. You can't, have lifetime or annual cutoffs in terms of your coverage. And then the third thing, there were so many, but I'll mention a couple other things. The third thing was to make sure you had a pretty good package, because we knew there was a lot of junk insurance being sold where people, they were selling policies in some states, you couldn't in New Jersey, but in some states that didn't include hospitalization, for example, which is absurd. And then we also had a Medicare component too, because we realized that we needed to do more with Medicare. So we tried to fill up the donut hole. There were limitations, we call it the donut hole. At some point in the year, you would no longer get your Part D prescription drugs because if you spent too much money on drugs. And so we tried to fill up that donut hole gradually over the next few years. It was working, I have no doubt, and ask any expert, anybody who's unbiased, it was working in terms of the ACA providing coverage to so many more people and guaranteeing elimination of these discriminatory policies. But of course, the Republicans started the sabotage from the very beginning. First of all, trying to go to the courts and saying that Republican governors and legislatures that we didn't have to expand Medicaid in our state if we didn't want to, and they ultimately succeeded in that. But the biggest problem, of course, was when Trump came in and started this whole process of repealing and coming up with what he said was a substitute for the ACA. We call it Trump Care. And of course, Trump Care, I'm not going to go into all the details because it didn't pass, thankfully. But Trump Care basically already tried to get rid of a lot of these things by saying that a lot of the Affordable Care Act mandates in terms of pre-existing conditions, in terms of essential benefit package, would simply be waived. Also cut the Medicare Trust Fund, so put the Medicare Trust Fund at risk. it was actually estimated by the Congressional Budget Office that if Trump Care, this was the replacement for the ACA that the Republicans tried to put in place, if it had passed, estimated by the CBO that something like 23 million Americans would have lost their insurance. Thankfully, that didn't happen. But what did the administration, the Trump administration, do instead? Well, they spent the last 18 months trying to sabotage the Affordable Care Act. And they are having very good success, right? They eliminated, when they did their tax bill, it gave all the money to the large corporations and the very wealthy. They eliminated the individual mandate. And insurance is a pool. So if you don't have an individual mandate, what does that mean? It means the wealthier people and the healthier people simply don't buy insurance. And then the pool becomes people that are sicker and older. And then premiums go up because you have to pay for all that because the insurance pool doesn't include everyone. Now, thankfully, the state, and we're at the State House today, thankfully the state legislature and the governor put the mandate back, but that's only going to be true in New Jersey. Most states haven't done that. I think only maybe one or two. Hopefully there'll be others. But then they started on all these other, the Republicans in Congress started on all this other sabotage in the Trump administration. And I can't even go through it all because it's, you know, so extensive, but I'll just mention a few things other than eliminating the individual mandate. Well, they refused to pay the cost sharing for people who were getting subsidies but still couldn't afford their copay, for example. They eliminated that, so that was the first thing. More recently, they went to court and said that we should be able to charge more for pre-existing conditions or not cover people with pre-existing conditions. They eliminated a lot of the outreach, so the money that was spent to tell people and advertise and have navigators and others that explained that you could sign up for the Affordable Care Act and what that meant, they tried to eliminate and have eliminated a lot of that. But in addition to that, I mean, one of the worst things is they started issuing allowing junk plans to go into place again. So they made these short-term health insurance less than a year that didn't have to include the essential benefits package. So you could not have coverage for mental health care or maternal care, for example. And now they're allowing those short-term policies to be renewed after 364 days. So essentially, if this goes through, you can have one of those junk plans forever. And they established associated health plans where different groups or trade organizations could also sell plans that were not, that didn't have a good benefit package. So I don't know, I mean, the list goes on. I don't want to keep repeating it. But the Congressional Budget Office estimates that millions and millions of people, 13 million people will be probably lose their insurance or not, you know, get insurance because of the individual mandate, and then all the other things that I mentioned before. So we're fighting back as Democrats in Congress. Of course, it's, you know, we're limited in our ability to fight back because we're not in the majority. But if and when, I'll say when, Bonnie, if that's all right, when we take the majority in November, we have a bill called the I think I'll call it the Stabilization Act, that basically we would put into effect if and when we're in the majority, that would seek to roll back a lot of these problems that the sabotage has taken place under Trump and the Republican Congress. And it would outlaw junk plans even on a short-term basis, say you have to have all the essential benefits in your package. It would provide more comprehensive subsidies so that if you know, even people at a higher income than now I think the cutoff is about 85,000. So even above that, you'd be able to get some subsidy, and we would increase the subsidy for people below that. We'd have a reinsurance component that allows more insurance companies to get into the market and provide more competition by guaranteeing them, you know, that they don't go broke or lose their shirt if they get into the market. And we would increase the outreach and pay for the cost-sharing subsidies. You know, the list goes on. So I just wanted to kind of outline what's been happening, what we would like to see happen in the future, assuming we're in the majority. And I guess, am I introducing Bonnie, or you're going to do that more? Or Moore's going to do it? All right. Thanks a lot.